Hey, it's Dr. Buford. We're just getting started on your left knee. This is the medial compartment, and we've already shaved a little bit of the cartilage up above on the femoral condyle. I don't see anything else that looks unstable. There's a little bit of chondral wear and tear on the tibial plateau down below. Okay, hold the camera for a minute. I'm going to manipulate the knee so we can look in the medial, posterior medial aspect of it here. Got it? Okay. In just a minute, we'll clear up the picture for you and show you this meniscus tear. Okay, so there's that meniscus tear. And again, we're going to clear up the picture. We'll show you some more in a minute. Okay, so this tear, hold the scope just like that. Yeah. That we see right here. Can you turn up my brightness all the way, please? You can see that split goes all the way back here. See that? And so ideally we could maybe put an implant here and another implant over here in a horizontal fashion to try and save as much of that meniscus as possible. Go ahead and open up the Super Ball for me, please. We've got a little bit of soft tissue here. So we'll keep looking. We're going to decide exactly how to fix this, but it looks like at first look that we're going to be using a device called a Super Ball to do that repair. Place one here, place one there. Just want to show you the rest of the knee. Your anterior cruciate ligament looks good. You have a little bit of a bone spur down here at the base, but the ACL itself looks good. As we try and sneak into the lateral compartment here. At first look, this compartment looks like it's in pretty good shape. We're going to look in a little more detail in a minute, but that looks pretty good, just to give you an idea. Okay, and so now we're looking at the patellofemoral joint. You can see the wear and tear changes in the patella up at the top of the screen and in the trochlea down below here. Okay, so I don't see much else to worry about here. Okay, so this device is from a company called Arcuro. It's called the Super Ball. It's an all-inside, all-suture way to fix the meniscus. There's our split there. Pause. Long press. Okay, so there's that really nice horizontal stitch. We've trimmed the inner edge of the meniscus. I don't want to go any farther because I don't want to affect our fixation. Hopefully that part will seal over and heal up with our PRP injection. I don't see anything else to worry. I'm just making sure there's no loose pieces. So I don't see any other things to worry about. We're going to place our PRP into what we call the meniscocapsular junction. And we'll show you how we do that in just a minute. So here's a pretty good example of how we take a spinal needle to kind of bracket the tear and inject our PRP right at the capsular junction. So through that little tube is where the PRP is going to be injected. Hold the camera, please. The water is still on. The pump pressure's down, but the water's still on. And we do that on purpose so we can make sure that we're intracapsular. And as we start to inject a little bit, you can almost see it start to come out of the tear there. See that? Look at the tear where that suture is. And so we know that we're getting good flow. There, you can see it start to come out there. So we know we're getting pretty good flow there. I'm slowly backing the needle out. And now the needle's out. So I'm going to turn off the pump, and we're going to put the rest of it inside the joint once we close up the portals. Good luck to you now. Bye-bye.